Chairman Harrell, we are now live and you have the floor.
Very good. I'd like to welcome everybody to the March meeting for the Pitt County Board of Health. We'll go ahead and call the meeting to order, and we'll start off with attendance roll call with Betsy Wallace.
Chairman Adam Harrell.
Present.
Vice Chair Tina Dixon.
Present.
Martha Engelke.
Present.
Rex Fleming.
Present.
Herbert Garrison. Mark Hayes. Scott McIntosh.
Present.
Nitish Patidar. I believe he is on a phone call.
He's on the call.
Kelly Pack Smith.
Present.
Lowell Spate.
Present.
Alex Albright.
Here.
We have quorum.
Thank you, Betsy. Next, we'll hear any public comments. And seeing none, we'll move on to the minutes from the February meeting. Those have been previously circulated to the board members. Any corrections, additions, or questions from the board? Seeing none, we'll seek a motion to approve.
So move.
Second.
Any opposed? All right, the minutes passed, I should say. Next, we'll move on to our fiscal report with Ms. Marsha Hall.
Oh, hey, everybody. I just hope you've got the documents that was emailed and hope you can see the screen. We are talking about the end of February of 2021, which is period 8. We had one budget amendment the month of February, which was $65,848. That was some state funding to help assist us with some COVID vaccinations, bringing our overall approved budget to $13,359,685. In a perfect world, which you know that we don't live in, we should be right around the 8.9. However, year to date, we have some timing items. We are looking at a surplus of a little over $1 million, which sounds like a lot of money. But as you all know, it's the timing issues of some of our funding sources. I do want to mention that the month of February, we did have a position. We got permission from the Board of Commissioners to add 1.0 FTE for one of our programs, NC Baby Love. This program receives no county funding, and that position will support 4 local health departments, but they will be stationed in Pitt County Health Department. We do have our Medicaid funding is slightly down, and that is due to, we have suspended services. And we also, we're still working out some issues with our dental safari, with our MPI crossing over into Dentrix, where we had to reach out to our state consultant to help us with NC Tracks, but we're hoping that's going to free up those dollars, our Medicaid dollars, and trickle down. I've got a couple other things. Are there any questions about the report in front of you?
You want us to go ahead and approve this, Marsha, or do you want to continue?
Whatever you'd like to do. I've got a couple of other little things, such as the grants as well. We're sitting pretty good with all of those. We have $220,535 overall. Some of these grants have not moved at all because they are committee grants. And when I mean committee grants, we work with Vidant Health with some of the Pitt Partners for Health programs. And the FDA has extended the deadline for some of our food and lodging. So you will see that mainly this is Triple P and the HIV pre-exposure where the costs are coming down. but we're sitting well there. Only other couple little things I want to mention. The Smile Safari did receive another grant, the Delta Dental Grant. It was $5,000, which helped us purchase some needed equipment. It's a high-speed air handpiece and some water test kits. And we're trying to get the word out to any of the middle schoolers or high schoolers that may be home every other week to come out to the health department. We normally don't visit middle schools and high schools, but now's a perfect time for them to come out and see us. And since this board approved seeing prenatal patients, that our clientele has really increased, that they're getting their prenatal care here. And I also wanted to mention, we are currently working on the 21-22 fiscal year budget. If you can see my desk right now, it is piles and piles of paperwork. We will be presenting that to you next month. We have about 29 of the AAs that are here. We're expecting about 7 or 8 more to come in. And Dr. Silvernail and I will be meeting with Scott at the end of the month to discuss some of the budget. And we present to the county commissioners on May the 4th at 8:30. It is a Zoom meeting, and I can send that link out closer to the date if any of you want to join us.
Great. Thank you, Marcia.
Welcome.
Any questions from the board? Comments? We'll seek a motion to approve the fiscal report.
So move.
Second.
Any further discussion or any opposed? All right, the fiscal report passes. Thank you, Marcia. Were you done?
Yes, sir. I'm
Great.
sorry, that was quite a bit.
No, that was good. Thank you so much.
Thank you.
Next, we'll consider any items of old business that need further discussion. Anything from the board? All right, seeing none, we will move on to the items of new business with a presentation by Dr. Angela Lamson.
Good evening. It's great to be with all of you tonight. I thought before I started this slide deck up that hopefully you'll be able to see. I would introduce myself quite briefly. I've known some of you for quite a long time. I am a licensed marriage and family therapist and came to Greenville and to East Carolina University in 1999, right before Hurricane Floyd. And I was brought here to start a program called Medical Family Therapy. So my training is to be able to see illness, loss, trauma, death in the context of family and how families interface with their communities. So over the last 20 years, I have been a part of a lot of systems to help create what's considered integrated care, looking at behavioral health in relation to healthcare, whether that's in a primary care context, it might be in specialty care. We're in a dental clinic. I've done a lot of work in military installations as well. So the whole idea is to be able to see behavioral and mental health simultaneous to dental or physical or other forms of health that might be experienced. I was asked to come to you tonight to just share a little bit, particularly with regard to youth and mental health right now through COVID. Can you all see the screen okay? Okay, great.
Yeah.
Wonderful. Let me see if I can move the screen here. There we go. So I wanted to just share with you that about 55 million youth, kindergarten through 12th grade, have experienced some kind of school closure throughout COVID. It won't surprise you likely as you're looking at some of these bullet points to see who has been most greatly influenced. I am both a clinician and a researcher, so I wanted to make sure I provided for you some resources as well on where you might be able to find additional information. I'm happy to send any of these articles to you if you want to learn a little bit more. But one of the things that's really stood out to me from this year is that when we looked at Medicaid and CHIP, which is the Children's Health Insurance Program data from 2020 in contrast to 2019, there were 6.9 million fewer outpatient mental health visits in 2020 in contrast to 2019, even though we had this surplus of telehealth and televisits available. So what we're noticing now is that it's getting to be much, much more difficult for people to be able to be seen by therapists. schools have been the de facto mental health for many children because they have school counselors or perhaps a school nurse in their contact, someone who might be able to help also bridge to services in the community. So obviously with school closures, many roles have changed for those that are school counselors, teachers, and community partners. While we think about many aspects of mental health, I want to make sure if you haven't heard the words adverse childhood experiences, these are incredibly important for me to consider as I'm working with children in the schools, I'm working with them in primary care, again, in dental, etc. That we think about the work of Filetti and Anda way back from 1998. They looked at these 10 factors that we need to be paying attention to because they have grown exponentially throughout COVID. They include things like, has your child experienced emotional abuse, physical abuse, sexual abuse, physical neglect, emotional neglect? Have they witnessed someone in their home treated violently, such as a guardian? Have they been exposed to substance use in the home, mental illness in the home, a parental separation or divorce, or incarcerated household member? So these 10 are not intended to be screeners, but rather for us to be mindful of the exposure that children are having in their own home. About 45% from this original work said that children have experienced at least one of these, but what we know is that when children experience 4 or more, they are 32 more likely to be labeled with either a behavioral or a cognitive challenge in their life. So I wanted to show you this pyramid. If you haven't seen it before, you are able to find it on the CDC website. What I pay attention to is what adverse childhood experiences a child has been exposed to. I don't ask children these questions myself. I go to guardians to better learn about their own experiences with adverse childhood experiences and then also their children's. Because what we have been able to witness is that when children are exposed to trauma, if you imagine at home being exposed to intimate partner violence and now having to come to school, it is really difficult to sit down and think about 2 + 2 = 4. Everything about that child's energy is focused on safety. So we begin to notice that as children are exposed to these adverse childhood experiences, they may have disrupted neurodevelopment. And I can share with you some of the ways that we work with children through some of these issues. But then it can get much more complicated. It has become even more complicated during COVID because of social and cognitive impairments. The children are much more isolated, and we're noticing intricacies in how they are isolated at home and isolated from peers as well. So it's important for me as I go into these environments to learn about these, because I know that as the number of ACEs go up, there's also a greater likelihood for adopting health risk behaviors such as smoking, vaping, risky driving. You can think about a number of ways in which health behaviors may shift. Unfortunately, those can become long-term diseases and lead to early death. For me as well, particularly coming to Greenville, I came to Greenville from Iowa, and there were so many elements for me to learn as I came to Greenville. There are 2 layers on the right-hand side that you'll see that look dramatically different than the pyramid I just shared with you. In addition to learning about some of the adverse childhood experiences, I have to take into consideration so many elements about our community, histories of exploitation, oppression from our past, and certainly begin to think about how race and social conditions, social determinants of health also influence a child's life. So some of the questions that I am starting to spend a little bit more time on, in addition to learning about those adverse childhood experiences, is that I also want to know if a child has experienced any harassment or bullying, either outside of school or in school. Mostly there is a lot of access through social media. And so I want to know if that has been a part of the child's life. I want to know as well if their child has seen any neighborhood violence and or been exposed to neighborhood violence. And then also if they have been exposed to any discrimination based on race, sexual orientation, gender identity, and so forth, so that I can take those factors into consideration. So the reason why I call this a call to action, particularly around ACEs, is because some of this information that I'm about to share with you. So child abuse related emergency department visits dropped during the COVID-19 outbreak. However, the severity of those injuries in the ED have actually increased and resulted in different kinds of hospitalizations. So overall, emergency department visits decreased, but the severity had increased. We're also seeing increases in family violence being reported and increases in parental mental health symptoms associated with anxiety, depression, and substance use. You can actually look at that by race and ethnicity on a particular CDC website to be able to see, particularly our people of color in our communities are having even higher rates of anxiety, depression, and substance use. So California has actually moved to a universal pediatric screening for ACEs in their primary care settings. I will use the word caution here because ACEs are not a screener. It's not actually a screener, but rather information to better know what our children are experiencing in the home so that hopefully we can begin to move toward protective factors. And I'll talk about those in just a minute. I also think it's important to point out to you coexisting health pandemics. I will tell you that since COVID began, there is probably no mental health condition and or experience I'm spending more time on than suicidal ideation. It has been quite tragic, actually, to see and to spend time with the number of teenagers who have never before had suicidal ideations, but now have been experiencing suicidal ideations. So while suicide was the 10th leading cause of death overall in the United States before the pandemic, it was the second leading cause of deaths among adolescents. So it's already been ranked as a high reason for death for our youth. It has become an even more pronounced concern during COVID, and particularly I'm spending a lot of time with Black children, with Hispanic children, with LGBTQ youth. So this statistic is actually from a 2019 article, but I always feel like I need to share it. I know that we have some providers here today that may not think that mental health would come up in a regular visit, but I assure you, if you ask, there will be a response, particularly about feeling suicidal. So I want you to know that nearly 30% of people in a study of 2,674 patients had had a healthcare visit 7 days before they died by suicide. 30%. Over 50% had seen a healthcare provider in the last 30 days before suicide. That was not just in emergency visits. These were in a variety of forms of healthcare. So we have to stay vigilant. I always make sure I share the 1-800-273-TALK, and of course, we're working on a national policy to use 988 in the future for these calls. I thought also it might be helpful. I know I've got an optometrist here tonight, or I think I do anyway. Not only in primary care and mental health do we hear about headaches, but also I think about the amount of eye fatigue that I have experienced during COVID. Headaches are among one of the world's leading causes of disability for children and adults. And what they're beginning to learn is how headaches and frequent reports of headaches, including migraines, are resulting in a correlation with frequent school absences, poorer school performance, and low quality of life. There are a couple of additional statistics here that pull this out even further for children of color, those children who are experiencing diagnoses such as ADHD as well. So all of those statistics are provided to you pre-COVID, but I encourage you to think about this because oftentimes when children do feel anxious about going to school, either stomach aches or headaches are a frequent reason that they are sharing they do not feel well enough to be able to go to school. There are a number of ways in which adverse childhood experiences may play out in the long term. I am really about thinking, what do we need short term, and thinking about different crises that emerge, but I also think we need to think about the long game. We've got quite a long game in front of us due to COVID, to make sure that children are in safe environments, are able to feel safe going back into their school system. Some kids are very excited about heading back in, and some are very, very concerned for a variety of reasons. And I'm happy to answer any questions about that. I never want to provide information about trauma without also thinking about protective factors that make a difference. So some of the research that's emerged about how we can better protect children, particularly as they're thinking about, can they go back into the schools? Can they play with their peers? Being able to focus on secure attachment is one of those. Attachment is usually set for a child in their first year of life to at least one primary caregiver in their life. But attachment has also gotten very disrupted during COVID, given that everybody has had many, many rules in the family. You may have a guardian who's working 2 or 3 jobs, had jobs disrupted, and is now perhaps even homeschooling without necessarily the skill set to do that. So attachment is really, really important. Strict sleep schedules has been also a very important ingredient and has been very difficult for both children and adults. I have noticed that there is a lack of just basic needs from food, housing, heat, access to telehealth or distance education. Oftentimes activity or exercise is very limited. We're finding ourselves in front of our computers for hours on end with not even the ability to stand up and sit down sometimes, or even use the restroom. One of the greater protective factors for children outside of any kind of classroom are clubs or programs. Again, these were sometimes limited when we think about our sports activities that children are a part of. But what in a study that I have recently done, I found that clubs and programs, particularly for children of color, were the most absent protective factor in their lives. So being able to find programs that can connect children to children through clubs, programs, et cetera, even if it's virtually, something that is non-related to their academics that can bring children together. And then lastly is telehealth services. While it took some of our practices a bit to get up to speed on telehealth, I will say that that is one of the biggest gifts that I have actually seen through COVID. Our very, very small team on just one project has met with over 3,400 people in just the last 10 months. I assure you, there is no way they would have been able to meet with at least half of them had we not had telehealth. So often we were able to get into some of the most rural and remote areas where people were getting misinformation about COVID. I felt like it was our way to not only provide accurate information, but also to do a behavioral health and mental health check. So that's really all that I have. You are always welcome to reach out to me by email. If you have any questions, I'm happy to entertain those right now as well. And I'm just so grateful that you allowed me to come and join you tonight.
Thank you so much, Angela. That was phenomenal. Any comments or questions from the board members?
Yeah, I will say, just going back to your headache comment, that I see kids with headaches. I'm the optometrist here on the board, that I see kids with headaches all the time, and it's always the parents. The kids were behind in school, they're hyperactive, and it could just be something as simple as that they need a glasses prescription just because they can't see the board. And headaches are always the number one thing that kids tell their parents that they have. Before blurred vision, they have headaches.
Thank you for sharing that. It was an unexpected finding as I was preparing for tonight, so I'm grateful that you shared that.
Any others? All right, thank you, Angela.
Thank you for having me.
All right, next up, we've got Ms. Robin Tant.
Hello,
Good evening.
good evening. All right, I'm going to try to get my PowerPoint up and going. Let's see. Can you see it out there? Can you see the PowerPoint?
Yes, we got it now.
Is it showing large or not? There it goes. Okay. All righty. Well, tonight, Dr. Silvernell had asked me to share some updates on WIC and working in WIC during COVID. So we've really changed a lot of our operation and just wanted to share some of that with you and tell you what's going on. So in since March 13th, 2020, we had waivers that went in place by the state. And basically what that means is we were able to waive physical presence, we were able to issue remotely by phone, and we were able to extend some of the certifications. And again, with these waivers, you know, these were people that were already on the program, so they were current participants. We've also got waivers in place for breast pump issuance. Much of that is done over the phone, and then the person will either come to the health department and we can provide curbside services, or we can provide breast pump drop-offs to the woman's home with no interaction. And if participants meet criteria for an electric pump, then they have an option to be issued a single user pump. So these are things that normally do not happen. Physical presence is something that's really important with the WIC program, but with COVID, we have been doing this for quite some time. Other updates is that, and this is a really important one, but the state is issuing 1 month of benefits daily to participants. The big problem with this is that some of the families are unaware that they even have these benefits. So what we've been trying to do in our with our program is our staff is calling these participants, because we do get a report each day of who has been issued to, and we're trying to contact them and let them know that they have benefits on their card. But again, many of them do not know. We also have WIC online referrals, and you can see the link there. If anyone wanted to go there, that would go straight to your county's WIC program, and we would contact you. The other nice thing, and I've spoke about this before, it's a newer app, but it's the Benefit app. And with this app, you can actually check your balance of your benefits. You can set your PIN so nobody else can use it. And so it's really a nice thing to have and be able to use, because it will tell you what you've got. And I've also included the login information for that. And normally when I mentioned the state issuing 1 month of benefits, what we go in and do is ordinarily a person comes in if they are low risk and they'll get 3 months of benefits. So if we get in contact with that person, we'll go ahead and issue the next 2 months for them. We are using Facebook, and we are using press releases to try to get this word out. But like I said, some people just don't know that they've got these benefits on their card. Another new thing that we have done with the program in preparation, which has really helped us in many ways, or will help us in many ways going forward, our nutrition staff is able to complete WIC remotely, and they can do the complete service. So in order to do this, we had to access Crossroads, agency files, we had to purchase laptops with some special funding, mobile printers, phones, and then headphones. So, you know, once COVID, I don't know if I should say is done, probably will be here a little while, but once we go back to some kind of normal, this will also allow us to do other things like outreach in terms of mobile clinics for WIC. So we're really excited about that. And we may not have gotten this far this quickly had COVID not happened, but we are able to do things from home completely in the event we had to. And you may wonder, how has this impacted our caseload? Because I did mention that the state is doing those automatic issuances. Well, it's increased it. So our new base caseload is 4513, which is a change from 4307. So not a huge difference, but it is a difference. And then in order to maintain that funding, we have to maintain 97% of the base caseload, which in this case is 4377. And again, going back to the state issuances, what the state has found, and other states too, this is nationwide, is that redemptions are not consistent with issuances. So basically what that means is that, you know, people are getting issued to and the numbers are higher, but they're not going to the store and they're not redeeming their benefits or their foods. So again, we're trying to get the word out, but right now that is what we're seeing. We've also adapted some areas of our breastfeeding program. We now have a virtual mom support group, and that's offered on the third Tuesday of each month. And we're trying to get that going, that platform going. And we've also got breastfeeding classes. So, well, actually, it's not our breastfeeding classes. It's a referral for Ready Set Baby, and that's done by Carolina Global Breastfeeding Institute, and it's taught in English and Spanish. So if anyone was interested, I have some contact information I'll show you in just a moment. And in summary, like I mentioned before, most WIC services can be done over the phone. That will not go on forever, but it has taught us some things about what we can do. And the state WIC program is issuing benefits to current WIC participants daily. And then if anyone has any questions about, you know, whether they've got benefits or whether they're on the program, some people don't even know they're on the program still. But if they have any questions, or even if they're new or have had a change in status, you know, in their income, they can call 902-2393. That's our main number. And as I mentioned before, the benefit app is wonderful because it can tell you what your balance is. So if you don't know if you've got any benefits, you don't even necessarily have to call the phone number. You can check that at the store. And like I mentioned before, breastfeeding support group is being held virtually. And if you have questions about that, call 902-2382. And as we know it right now, and this is subject to change because it has changed so far, the waivers will remain in place through May the 22nd, 2021. So that's what we know right now. Again, that could be a change, but that's what we know right now. Are there any questions?
Thank you, Robin. Any questions from the board members? All right, very good. Thank you again, Robin.
Thank you.
And next, we'll hear from our Deputy Health Director, Miss Amy Haddam.
Hello, can y'all hear me?
We can.
Okay. Well, I'm happy to share with you about a new scheduler that we have, an online scheduler for COVID-19 appointments. We were implementing this new scheduler to improve access to the public for making appointments to get the vaccine. And we now have this appointment scheduler on our website. It can be accessed by the public without staff assistance. And I want to put out a huge shout out to our county management information staff, especially Hannah Hines and Donna Davis, for making this possible. They've spent much time researching many vendors to find one that would not only accommodate our needs, but one that was also HIPAA compliant. Thanks to Hannah and Donna, we're now using this scheduler that's made possible through a vendor called TimeTap. This scheduler does offer numerous features. It allows us to collect various patient information. It also allows us to pre-screen patients to make sure that they're even eligible to receive the vaccine. And patients, when they're using the scheduler, they're required to attest that they are part of the eligible groups at this time to receive the vaccine. Up until this point, we had not seen the need for an online scheduler because we were basically scheduling people in groups, such as school teachers or various groups that we would go out and target. Now that more and more individuals are eligible to receive the vaccine, especially essential workers, there's a greater need, an increased need to have the online scheduler. So now, eligible community members who fall into those 3 groups can now visit online our main website, our main county website, and this is for the public at www.pittcountync.gov. They can go there. There's a huge pop-up box that's on there that our Carla Hansen, Public Information with the county, has put. You cannot miss it. So it pops up and individuals can conveniently schedule an appointment. Right now, there are 2 options for the Moderna vaccine, where we're doing clinics throughout the week here at the health department. And then we will have 2 mass clinics Thursday and Friday at the Ag Center for the J&J vaccine. And that's compliments of the hospital sharing that with us. So there are 2 options that individuals can go on and schedule their own appointment. And they do have to attest that they fall into eligible categories before they can make that appointment. We also have a recorded message about vaccine making appointments. Individuals who call our main switchboard at 902-2300 can press option 7. They automatically go to a recorded message that repeats our website and any updated information about the vaccine and any eligible categories at this time. And I do want another shout out for Carla Hansen, our interim PO director. She is constantly strategically placing appointment information on our website to make it easy for the public to find it and making any edits and updates as needed as vaccine availability changes. In addition to the option 7 on our phone line and being able to go online to make an appointment, we still have our COVID-19 hotline that is available for the community. Individuals can still call that Monday through Friday from 8 a.m. to 5 p.m., excluding holidays and of course weekends. That is our main number, 902-2300, option 4. And there will be someone there to assist individuals with general questions. They can also assist individuals who do not have access to internet to schedule an appointment. So they are available to do that Monday through Friday, 8 to 5. I do want to give a shout out to our health education staff. They have been manning these phone lines for almost over a year now, and they are tired, but they continue to hang in there and they're continuing to provide great customer service. But I do want to let them know how much we appreciate, all that they've contributed to this COVID response over the last year. In addition to TimeTap, the schedule that we are working with right now, we've also been researching the possibility of eventually utilizing an online scheduler through Epic, which is our electronic health record. Last week, Dr. Hardy, our nursing director, and staff from MIS participated in a live demonstration that Vidant provided regarding the use of the Epic scheduler. Right now, we're comparing options with what TimeTap offers as well as what Epic offers. And we're seeing benefits of using both. Right now, we're using TimeTap, for our COVID clinics. Eventually, we may want to move to Epic, not just for COVID clinics, but for some of our internal clinics that have been going on, pre-COVID, that we might be able to offer better access to care for individuals who want to go online to schedule an appointment rather than trying to get through our appointments line. And this, of course, would be post-COVID when we're trying to get things back to normal. So lots of exciting things to help us improve access to care for the community. And that's all I have with that.
Great. I know y'all are excited about that.
We are.
Any questions or comments from the board, Ramey? All right, hearing none, we will move on to the health director's report with Dr. Silvernail.
Good evening, Dr. Harrell. Good evening, board members. Want to give a shout out to Dr. Lamson for preparing her presentation on relatively short notice as a request from me. Angela is kind of my go-to behavioral health person. And when I reached out to her, she's very happy to do that. And I think present some valuable information for the board's enrichment tonight. So let me share my screen and we'll go through my report with you all. See myself anymore. And you should see my title screen there. And I want to start out talking about staffing with you. Please join me in welcoming Angela Manning as the new Division Director for Environmental Health. Angie started on Monday and has hit the ground running in environmental health. This takes a big load off of me in terms of trying to be the health director, medical director, and environmental health division director throughout COVID. So I think Angie's going to be a great addition to our team. She was formerly with Pitt County Health Department prior to taking a position in Wilson County as their director of environmental health. So again, please join me in welcoming Angie to our team. We continue to struggle with open nursing positions. We have moved some individuals around internally, but the same number of positions remain open. I know Jennifer's report was included in your package. We have 7 open nursing positions right now in the department. We do have multiple applications for some of our open nursing positions. I know Dr. Hardy and her team are struggling to get folks interviewed in the midst of COVID operations. We had one candidate in today that they were interviewing today, and we are interviewing a physician extender 3 candidate, a nurse practitioner candidate tomorrow. So hopefully I'll have happy news to report out of those interviews. Our staff is weary, but they continue to push forward in this battle. My hat's off to them. They get up every day and they come to work and they do a great job. I remain concerned about what our workforce is going to look like when we get to the other side of COVID. I am fearful that we may lose more, and I fully expect that there will be more departures and or retirements before and after the end of COVID. As directed, I made a request to Ms. Florida Hardy, the Pitt County Human Resources Director, for a comparative market analysis of salaries across all public health positions. I told her the board was hoping to hear that in 60 days, so I will ask her if she can present at next month's meeting to give us a report on that market analysis. I want to spend a little bit of time reviewing the Pitt County data with you, COVID-19 data. This is where we were last month at our last Board of Health meeting. At that point, we had had a little over 1,400 cases in the previous 14 days. That was a rate of about 100.8 or 101 cases per day. And we look at this, well, the state expresses this in rate per 100,000 or 10,000. I think on the local level, it's better expressed as a rate per 1,000. So at that time, that was a rate of 7.6 cases per 1,000 residents in Pitt County. At that point, we'd had over 16,000 cases, representing about 8.8% of Pitt County residents. And we estimated that in excess of 14,000, nearly 15,000 or 90.9% of those cases were recovered. We had accumulated 72 fatalities to that point. But happily on at last month's Board of Health meeting, we had reached a new low in our in the range of our case fatality rate of 0.4. That did hold for a while. It's crept up a little bit. I'll show you that on the next slide. Our percentage of tests returning positive was at 8.4%, which was down from a mid-January high of 13.6% across all testing providers in Pitt County. This is where we are today. Our active cases, the cases over the last 14 days, 562. That's a rate of about 40 cases a day, down from 101 cases per day. Our active cases per 1,000, we're down to 3.0 today, which is back to really spring and summertime levels of COVID last year. Our total cases today are 17,745. That represents roughly 90% of our Pitt County residents to have known to be infected or been infected with COVID. We estimate that 17,100 of those cases are recovered. That's 96.4% of cases at this point in time are recovered. Unfortunately, we have added to our death toll since last month. We were up to 83 fatal cases throughout the pandemic. Our case fatality rate has crept up a hair to be just over the rounding to make it 0.5 instead of 0.4, but still at the lower end of the range that we've seen for our case fatality rate throughout this. I think when we reported this last month, we were at 0.44, and we'd actually gone to 0.43 unrounded in our case fatality rate. So we've crept up a little bit, and we see that our deaths seem to get reported in clumps, and it takes some time for non-fatal cases to accumulate to bring that rate back down. And today our rate of tests returning positive was 5.0%, down from about 13.9%. When we look at testing in the county, we are still most weeks above, I don't think we've been below 6,000 tests across the county in any one of the last 4 weeks. and several of those weeks were higher than 6,000 tests per week in the county. Testing remains widely available throughout Pitt County, the Pitt County medical infrastructure. Want to talk to you a little bit about vaccinations and where we are with this. And I think in spite of the challenges, there's really some good news in where we are with vaccine. Vaccine is available from Pitt County Health Department, from Vidant, from the joint Vidant Pitt County site at the Greenville Convention Center. The Walgreens stores and long-term care program are vaccinating folks in the community. ECU Physicians has now been granted its own supply of vaccine, so they are doing some vaccine work with their patients and in the community. And we were told last week that the CVS stores would be coming online soon as part of the federal program to roll vaccine out through chain pharmacies. So we're hopeful that will come. Again, I think the broader we can make the footprint of distribution, the better it will be for everybody in terms of vaccination. Other providers are coming online in CVMS, but they're not yet being supplied. So we've seen some of our Harris Teeters are in the system. One of our large commercial manufacturers has its medical clinics in the system, but they're not yet receiving their own supply, but may do so in the near future if supplies continue to improve. Johnson & Johnson's vaccine, as you know, was recently approved, also known as the Janssen vaccine or Janssen Pharmaceuticals. Biden did receive a supply of that last week and transferred 500 doses to Pitt County Health Department. We are holding 2 clinics this week on Thursday and Friday at the County Ag Center with 250 vaccinations per day with the J&J vaccine. And I really think this is a great option for Group 3 individuals. Most of our Group 3 individuals are under the age of 50. This is one absence from work for them. It's one release from work for the employer, and it's one shot for us as the vaccinator. So it really is a win-win for everybody involved in this group. And we're looking forward to running those clinics on Thursday and Friday. Mobile vaccinations, Pitt County EMS, Pitt County Health Department, Dr. Portella and paramedic Jim MacArthur have been out and doing vaccine clinics for us amongst our EMS and first responders. And as boosters have come up, we've given them the vaccine and they've just gone out and done it for us. They've been a great help in terms of broadening our distribution network to our first responder community. Paul Shackelford, many of you know Dr. Shackelford, goes by Shaq. Everybody calls him Shaq, at least in the medical community, we all call him Shaq. He's working with the ECU Health Sciences Division, reached out to me about also doing some mobile vaccine work. We reached an agreement with him to use his team to help us with our long-term care facilities and may use that team to hit some other segments of our community as well. Dr. Shackelford is now, since ECU Physicians is being supplied with vaccine, is also receiving vaccine through the ECU side of the equation. And he didn't want to just go out and do vaccinations without consulting with me. So he has reached out to me and for guidance on where he might best use his vaccine. And we had some contact with the Aden Housing Corp or Aden Housing Authority with request for vaccination for their residents. And last week he received 200 vaccines. They had 200 folks. It was a good day's work. Shaq took his team down to the Aden Housing Authority and gave 140 vaccines. So he vaccinated almost 3/4 of the folks who live in the Aden Housing Authority. And then he had 2 vaccines that were drawn up and he didn't want to waste them. So he drove over to Piggly Wiggly and sat in the parking lot with his ECU van and his team until he found 2 folks willing to accept those vaccines in the parking lot of Piggly Wiggly. So my hat's off to Dr. Shackelford for being so aggressive and not wasting vaccine and helping to get that out in our community. Pitt County schools, between the health department, between Vidant and Walgreens, I'm happy to report that all Pitt County schools, faculty and staff wanting vaccine have received or are scheduled to receive their COVID-19 vaccine. We had anticipated having to run other clinics for them for first doses, but between the efforts of the health department, Vidant, and then getting people into Walgreens to be scheduled, we've been able to get everybody that wanted vaccine their first shot or scheduled for their first shot. It was spread over a couple of weeks, but everybody's at least scheduled or has their shot. We will be doing a booster clinic for the group that we vaccinated That was 388 individuals from the school district, and that'll be on March 26th. So we'll be have a busy Friday in a couple of weeks to get their boosters done. Private schools and childcare workers, we've opened up appointments for them at the health department. Uptake has been a little light. It's been less than we anticipated. And we do have vacancies or openings in the schedule. So if you know anybody who's in this group that wants to get vaccinated, please tell them to book an appointment with us. We have vaccine, we have appointments. We'd love to get them vaccinated. Our numbers, the state updates the vaccine numbers every couple of days. It's done as of 23:59 hours on a given date. So these numbers are from essentially midnight last night on 3/8. Across the county, we've given a total of 53,879 doses, 31,147 first doses, representing about 17.2% of Pitt County residents, but 22,732 second doses have been given, and that's just over 12.6%. 12.6% of our county residents are now fully vaccinated. With the J&J vaccine coming into the county being given by Biden and by the health department, folks who will be considered fully vaccinated will rise quickly in our county data. I didn't put any of the racial and ethnic data there. Across the county, for African Americans, we're about 25% African American in our data. Internally in the health department data, we were 30% African American. Our Hispanic friends are underrepresented still. They're about 2.5% across the county, maybe just a hair higher in Pitt County, but certainly not anything more than 3% in the health department data. So a little underrepresented still. Dr. Hardy's planning another event to reach that community with our community partners to try to encourage Hispanics to come in and get their vaccines. Wanted to take a few minutes and talk to you about some of the COVID partnerships that have developed throughout the pandemic. We've been so busy running around trying to respond to this thing that telling the story, we don't always tell the story as well as maybe we should, but it's because we've essentially been in a fist fight since last March, maybe even a little bit before. As you know, we're approaching our anniversary for 1 year in Pitt County. Our case zero, patient zero, tested on March 12th, but we didn't receive results until March 19th. It took a week to get his results back, and that's when we officially reported our first case, but he actually tested on March 12th. So that'll be a year this Friday since our first positive COVID test was collected in Pitt County. So responding to COVID-19 has required the cooperation of many individuals and groups. Please put up with me for a few minutes while I highlight some of them. Vidant Health really been with us in this fight since the beginning. The swarm team that they created internally has helped with testing. We needed to do a testing at one of our local nursing homes when they had an outbreak. It was our first nursing home outbreak. Vidant was able to put some of their staff over there to help train the facility staff to do the collection so that we could do the testing and retesting that needed to be done in that facility. Was a great help to us in that situation. They have been doing some monoclonal antibody infusions to long-term care facility residents. And we recently had one of our long-term care facilities had a little bit of an outbreak. And we said, hey, listen, we can get you the monoclonal therapy for your residents in the facility. Are you interested? And they said, yep. We made a call to Vidant. We hooked them up with the folks at Vidant, and Vidant sent folks out there with the monoclonal antibody to treat those symptomatic individuals at that long-term care facility. So just a fantastic partnership, and something that you probably haven't heard of before. On the laboratory side, we have sent some testing to commercial labs and to the state lab, but predominantly the thousands and thousands of tests that we have done through the health department have gone through the Vidant lab. On the very, very heavy days, we've even relegated our lab order entry to them. They charged us a little bit more to do that lab order entry, but it saved my staff hours of work of putting these tests into Epic, and helped speed the process up so that if we tested somebody on Monday, we had those results back early on Tuesday. So basically next day turnaround in our laboratory testing for COVID. Of course, the joint vaccine site at the Greenville Convention Center, And then we have had a series of meetings between the health department, between Vidant and some of our other local partners to help coordinate the distribution of vaccine in Pitt County, basically dividing up, well, we'll take this group, you take that group, and trying to make sure that the vaccine was distributed fairly throughout the county and where it needed to be, so we weren't duplicating efforts in the distribution of vaccines. So been a great partnership. Pitt County Emergency Management, you know, I can't say enough about Randy Gentry, Jim MacArthur, and Dr. Robert Portella, Bobby Portella. They have been at our side since day one. You know, during the testing program, they set up and took down our testing sites. Randy was, well, why can't we just set up in Farmville and be there for a week? And I said, Randy, we need to, in order to understand the distribution of the disease, I need that test site to rotate so that we have, you know, essentially simultaneously monitoring around the county. Okay, Doc, we'll do what you need. You know, and he and his folks picked up our equipment and moved it from site to site every day during the 5 days of the week while we were running our testing program. Acquiring and moving supplies. If we needed it shipped and picked up, moved, Randy and his team have been there for us to do that. I got a call a week or so ago that Forsyth County mistakenly got 200 doses of our vaccine. We needed to figure out how to get it from Forsyth County to Pitt County. Reached out to Randy. I said, Randy, you got anybody who can make a pickup for us? He said, Doc, give me the connections. I'll take care of it. Got him. I spoke with the health director out there. We hooked our respective people up, and Randy was able to make the swap, send somebody out to Forsyth County to pick up those doses of vaccine and get them to Pitt County Health Department. So just a fantastic partnership. Again, mention our mobile vaccine team for first responders, and then the support of our Pitt County Health Department clinics. Bobby Portella has worked some or all of those clinics, both in the health department and at the Ag Center, to help us with the medical screening of individuals. Jim MacArthur has been there, both giving vaccines and as our EMS backup in case we had a serious allergic reaction. Again, just a fantastic partnership, fantastic teamwork with our emergency management folks. The county PIO office, we wouldn't be on the meeting tonight if it wasn't for these folks. They're the magicians behind the scenes who make all this stuff work. They have coordinated multiple press conferences since our infamous Friday the 13th press conference last March at AHEC. Many of them at the health department, many of them in the commissioner's auditorium, and now virtually all of them on Zoom again, they're the folks behind the scenes that make us look good. So thank you guys, Kyle, Carla, Ryan, all you guys, fantastic job. You know, they're a little department, but they certainly outperform their numbers by a long shot. And the other thing they did to kind of help me with our Polar Express Day, we staged a recording and reading of the Polar Express done in the Commissioner's Auditorium, where they filmed me reading the Polar Express, did the post-processing, and then put this up on YouTube so that it was available to children in our community and really anywheres so they would have somebody who could read the Polar Express to them during the holiday season. So again, thank you guys, fantastic job. ECU, this is only probably a partial list of all the cooperation that's gone on back and forth between ECU and the health department throughout this event and this pandemic. We helped work with ECU to establish an on-campus contact investigation and training program using their public health students and folks from the Student Health Service. We were also able to give them some support from the state-provided contact tracing surge staff pool to help with investigation and tracing. We tried to get them their own access to NC COVID, but the state balked at that and would not give them direct access to NC COVID on the grounds that they are not technically public health employees, even though we adopted them into our structure to help with dealing with the campus, which was far beyond the resources we had in the health department alone, given the number of students on campus. We have, myself, my staff, supported Student Health Services with testing information, testing kits. We've provided some of the antigen testing kits to Student Health Services, technical support to them. And in return, Student Health Services has provided support to us, sending nurses and advanced practice providers, even a physician, to help with our vaccine clinics in terms of giving vaccinations and doing the medical screenings at our clinic. Lanika Wright's the director over there, and they're one of their lead clinicians, and she's been a great partner to work with. I have had direct access to the chancellor, and the chancellor's had direct access to me throughout this. If Dr. Mitchelson's needed to talk to me, he's got all my contact information. He can call me on my cell phone, my direct office line, email me, text me, and I can do the same thing to Ron. And he arranged a meeting with the incoming chancellor, and Dr. Rogers and I met recently via Zoom and agreed to continue that working relationship going forward, for the benefit of the university and the community. When we've tried to put some of these programs together and we hit a roadblock, was able to reach out to Dr. Mitchelson and say, hey, Ron, we've got a roadblock here. No problem, John, I will remove that. Really been a great partnership between the two of us. At the request of Chancellor Mitchelson, the athletic director, I went over, did a walkthrough at the football stadium, and we came up with some planning scenarios, not being sure of how many folks they would be allowed to have in the stadium. We walked through looking for vulnerabilities where social distancing could break down, and talk through that and help them develop a plan so that they could safely have spectators in the Dowdy-Ficklin Stadium for football season. Again, I mentioned the mobile vaccine team from Dr. Shackelford and his folks, both for Pitt County Health Department, where they go out and do things at my behest, and then in cooperation with Pitt County Health Department, where they receive vaccine and say, where can we best put this? And we're also working with them now to get a date for West Greenville and the Greenville Housing Authority to help get some vaccinations into that part of our community. And again, thank you to Dr. Angela Lamson. She's kind of my behavioral health go-to person. Asked her if she would present to the board tonight, without hesitation, said yes. Last fall, I reached out to Angela. We had worked together when I was at Ock Health on an integrated care program. I actually had an integrated care program at Ock Health for a while. And said, hey, Angela, I really think I'd like to do this in our Pitt County Health Department clinic. She came over, met with my senior leadership staff, came back with her partner in crime, Dr. Jennifer Hudson, and did a listening event with our staff to see what they were seeing in clinic and what they thought the needs were. And then without my request for it, went out and wrote a grant, which we don't know if we're going to get the grant yet. Went out and wrote a grant that may potentially underwrite an integrated care program at the health department for several years if we are awarded that grant. So the only thing I had to do was write a letter of support for it. She really did all the work on that. So thank you to my friend and colleague, Dr. Angela Lamson, for all of that. Our community partners, quick mention, AMEXCAN, we've been participating in their task force meetings. We've worked with them to schedule a block of time set aside for Hispanic community members to come in and get their vaccinations. The uptake was less than we would have liked, but we are working with them on another date. CARE is part of that. CARE is also tied in with the African American community, where we've been at the health department very successful in getting African Americans to come in and get their vaccine. I said internally we're 30% or maybe a little 30%, over 30% of our vaccines have gone to African Americans. Pitt Greenville NAACP, I've done some town hall meetings, other meetings with them. I've spoken with their medical advisor, Dr. Don Inslee, and their president, Mr. Calvin Henderson. Sycamore Hill Church was the site of our federally provided testing site. Commissioner Floyd Huggins had suggested perhaps doing some testing at Sycamore Hill Church. When the federal government and the state offered up the site, we reached out to Sycamore Hill. Pastor James was very willing to let us use the parking lot and the facility, giving us ice, giving bathrooms for the testing staff. And that site ran for a couple of months over there, was very successful from a community standpoint. The Andrew A. Best Medical Society, Old North State Medical Society, and Koinonia Christian Center, plus Pitt County Health Department and Pitt County Emergency Management combined last summer to conduct a community testing event at KCC, where almost 300 individuals were tested for COVID over there. A very successful community event. Rodney Coles, I think y'all know Rodney Coles, what he does in our community, his Churches Outreach Network. Rodney is a long-standing partner for public health. Reached out to Rodney recently and said, Rodney, we need you to shoot some footage for us for some public service announcements. Something else that should have been in the PIO thing. They've done some public service announcements for us as well. And Rodney said, no problem, John, I'll be there. Tell me when and where, and I'll come in and we'll shoot some video so we could bank that for some upcoming PSAs. And he was at the health department to help us do that. And then the West Greenville Health Council, we've done some things with them in terms of trying to reach out into the community and get information to where it needed to be to address vaccine hesitancy and understanding COVID and its transmission. So a lot of work with our community partners. The battle continues, folks. I feel like we are gaining on this thing. I'm not willing to say we've turned the tables on it yet, but I definitely feel like we are gaining on COVID, and I'm ready to chase it the heck out of my county. Thank you to all my hardworking Pitt County Health Department staff. You guys are the best, and I am happy to take your questions or comments or further discussion. I'll stop my share there. Did I bore you all to death?
It seems lighter than it normally does, so that was good.
Well, it's nice to be able to report some good news for a change,
Yep.
Dr. Harrell. And our numbers really are in decline at this point. We'll see through the Easter holiday that's coming. If we get a little surge with Easter, human disease follows human activity. So we may very well see a little bit of a surge there. But we're also, the number of folks that are vaccinated is growing rapidly, and that's a help. So if you think roughly 10% of our folks we know have had the disease and are likely still immune, 12.5% are vaccinated. We're north of 22%. There's a little bit of overlap there, but we're still north of 20%. So more than 1 in 5 of us are immune. If you say we know 10% of our population has had it, for every case we know of, there's probably at least one we don't, maybe more in some age groups. So we might be north of 30% of folks with some immunity to this infection, either by having had the infection or vaccination. So that is starting, I think, to take a bite out of transmission here in the county. And like I said, I feel like we're gaining on it, but not willing to say we've turned the tables on it yet.
Dr. Silvernail, can you quickly hit on who is eligible in Group 3 to get the vaccine for those that don't know?
Sure. Why don't we run over the group thing? Group 1 are healthcare providers, long-term care residents, long-term care staff. Group 2 is strictly by age. So that's anybody over the age of 65. Group 3 was sort of fractionated by the state, initially opened for school faculty, staff, and childcare workers. They gave us 2 weeks to do that. And then we opened up to the balance of Group 3, which is anybody who's considered an essential worker. So if Dr. Cohen has been quoted as saying, if you leave home and interact with the public in your work, you're considered an essential community worker. So that would include grocery store staff at Lowe's and other hardware type stores, our rank and file police officers, firefighters who are non-EMS providing firefighters who were not previously eligible, agricultural workers, retail workers, basically anybody that is a worker that is public facing. It would be considered eligible under Group 3. So many of our manufacturing folks are eligible, utility workers like Greenville utility folks who previously were not eligible or working. This would also wrap in transit authority folks. So think on the county end, that's our PATS drivers and staff. It's our Pitt Greenville Airport staff. Within the city, it's the transit staff for the Great Bus. It's the city PD. It's also our community police forces. So any of our municipalities that have their own police force would include those individuals. Our detention center staff and sheriff's department. So pretty much if you're a public facing person in the workforce, you are eligible under Group 3 at this time.
Thank you, Doc. Any other questions or comments from the board members for Dr. Silvernail?
Yeah, I do have a question and then maybe 1.5 comments. Dr. Silvernail, I'll have to take you back to the early part of your presentation. I'm sorry. But for the benefit of our audience, will you explain how COVID deaths are counted for our county again, just to make sure that we're all on the same page?
Sure, Kelly. There are really 2 different ways. From a public health standpoint, the individual must have a positive COVID test So that can be a PCR or an antigen test. So they have to be confirmed to have COVID. They have to have a clinical syndrome compatible with COVID. And then they also have to have no period of recovery prior to the death. So if you get COVID and you recover and then you die of something, would not be considered a COVID death. So positive test, syndrome compatible with COVID, no clear period of recovery, and no other obvious cause. So if you have COVID and somebody shoots you, and we actually did have that happen here in the county, you would not be considered a COVID death if you died of a gunshot wound, for example. In the what we call vital statistics data, we do see deaths in the vital statistics data. And, death certificate data is based on the certifier's impression in most cases, unless that case has gone to the medical examiner and the medical examiner determines a cause of death. So if I'm the attending physician and I certify a death and I say it's a COVID death, I may certify that as a COVID death even without a positive test. So we are seeing some deaths through the vital statistics system, which at this time are not lumped into that 83 death toll, because public health surveillance is different than vital statistics surveillance. The state has told us at some point they will reconcile that, but at this point they are considered separate data streams.
And does place of residence play into how those numbers are counted?
Absolutely. So like any other public health data, it is based on county of residence. So if you were a Pitt County resident, but you happen to end up in one of the Raleigh area hospitals, that death would still be attributed to Pitt County. And likewise, if you're from Edgecombe County, but you died at Vidant Medical Center, that death would attribute back to Edgecombe County.
Very good, thank you. And then my last comment is, as you were talking about some of the mobile vaccination efforts, I noticed that there are a lot of similar names and organizations that between Vidant and the health department. And I wanted to make sure that you continue to have access to information to know where other organizations are moving about in the community so that we're not duplicating effort. And if you don't feel like you have access to that information or that intel, if you will please make sure to let me know so that we can connect those dots. The precious few staff already, and so we want to make sure that we're not duplicating efforts where we don't have to. And then lastly, just to offer support as it relates to ramping up vaccination efforts in our child care workers and in our essential workers group. I understand that that's going to be a very tough group to kind of crack into. We deal with a lot of challenges and barriers to vaccine uptake in a good part of that community. And however we can continue to provide support, we are happy to do that.
Mm-hmm. Thank you.
Thanks, Kelly. Commissioner Albright also had a comment or a question.
Yes. Can you hear me?
Yes.
I can.
Yes. Thank you, Dr. Silvernail. Just real quickly, and I think you've clarified this, but I want to make sure when you say the percentage of people in the county that have been vaccinated, that's coming from the state data of residents and not from the numbers that are being vaccinated in Pitt County. Is that correct?
That's correct, Commissioner Albright. It's like any other public health.
Right. Okay. That's what I thought. Yeah. Thank you.
Yeah. So
thanks for the good news.
Oh, you're welcome. So when we vaccinate somebody from, let's say we vaccinate somebody from Wake County, that would attribute back to Wake County as a vaccination. Gotcha. And likewise, if Wake County vaccinated a Pitt County resident, it would attribute back to us.
Thank you.
You're very welcome, sir.
Any other questions or comments from the board? All right, there's a lot of good information tonight. If nobody else has anything, we'll look for a motion to adjourn.
I move to adjourn.
Second.
Any opposed? All right, the meeting is adjourned. Thank you all so much. Thank you, Dr. Silvernail, and we'll see you guys in April.
Thank you, Dr. Harrell. Have a good evening, everybody.
Take care.